be a part of this movement and be here with you all. Here we have Senator Johnson, who has been such an inspiration and honestly a guiding light in this whole process for us and support for Bobby Kennedy. And so we're just very excited to have him here, and I'll let you kick things off.
Thank you all for coming here. I was in the Oval Office about an hour or so ago and watched Neil Gorsuch, Justice Gorsuch, with President Trump present, swear Bobby Kennedy in as the new Secretary of Health and Human Services. I believe, I'm hoping this is a watershed moment for America. I described in Bobby's hearing that I remember when he called me and said that he was thinking about joining forces with President Trump. He was asking me whether he thought he could be confirmed. And the first words out of my mouth were literally, Bobby, this is an answer to my prayers. I'd gotten to know Bobby during COVID. We were trying to convey the same truths to the American public. I understand the price that Bobby Kennedy has paid fighting for children's health, fighting to get the truth out, fighting to expose the corporate capture of our federal agencies. I know the political and personal price he was going to pay for making the decision to join the forces with President Trump, but I couldn't be more happy that he did so. It's important not only because by President Trump and Bobby Kennedy putting their differences aside and focusing on an area of agreement to solve a problem, it not only demonstrates exactly how you solve a problem. Let's face it, I don't agree with anybody 100%. So if I'm going to solve a problem, I'm going to set aside differences and focus on that. But I think even more important, it demonstrated to America what we are going to need to do politically to heal and unify a horribly divided nation. So to me, this is a moment of true hope. One thing I found out in all of my recent activity, whether it's working with doctors, looking at COVID and the vaccine injured, and those events I held, the event I held with Bobby Kennedy and Dr. Casey Means, her brother Callie, and all those nutritionists, is this MAHA movement. There is absolutely nothing partisan about it. I know Bobby in that one event said, I used to be a super villain to him, the way I was portrayed in the media. But it's amazing when you actually get to know somebody, up close and personal. Those differences just melt when you focus on something so important as what is driving chronic illness. What has caused this incredible upsurge in autism? President Trump was speaking about that. It was actually a 1970 study. It's very, very hard to conduct this study, but they're trying to get some sense of what is the rate of autism, and that study reveals about 1 in 10,000. That's back in 1970. Fast forward to today, something like 1 in 36, 1 in 34. I hear different numbers. California's 1 in 22. Anybody you know is a family with an autistic child, particularly a severely autistic child. I mean, this is a tragedy. These are tragedies that have to be prevented. We need to understand what's driving, what are the root causes of chronic illness, what's the root causes of chronic illness. We can't be afraid to ask those questions. And that's what's so unfortunate about this whole process leading up to this is people like Bobby Kennedy, they haven't even been allowed to ask the question without being ridiculed and vilified, and that has to stop. Because as I said in his hearing, the American people desperately want these answers on a completely nonpartisan basis. So, Bobby Kennedy is dedicated as the Secretary of Health and Human Services to what he describes as radical transparency. I'm the chairman of the permanent subcommittee investigation. I can tell you in my investigations, the federal government is opaque. They are so far from transparent, and that's a real problem. The government belongs to we the people. The information the government collects, the analysis it does on their safety surveillance systems, it's public information. It shouldn't be withheld. So I am pleased to introduce Del Bigtree from the Highwire. a man who has been engaged in radical transparency, paid the price. Now, I think you've probably been vilified, ridiculed every now and again. But this is about the truth. This is what the American people not only want, not only demand, but they completely deserve it. So I'm just happy to play a bit part here in this, enormous and a growing movement of making America healthy again. And again, at the forefront of that for many, many years. I've learned so much from Del Bigtree. I think Americans have learned so much from Del Bigtree. So, my hat's off to you. Thank you for all you've done, and welcome to the stage.
Thank you. Senator Ron Johnson's been a lone voice in the wilderness inside of government for many years, and we are eternally grateful for all the hearings and the things that he has done to bring awareness to the reality that is taking place today. It's very simple. This is a story that's been blown out of proportion. The misleading facts have been coming from mainstream press. The fact is this: vaccine injury is real. It happens. People are injured every single year. Children are maimed and killed every single year by our vaccine program. There are many that will say, well, it's rare. Does that mean we shouldn't talk about it? Do we talk about rare diseases? Do we try to cure rare diseases? Why is it in this one topic you are ridiculed, attacked, said that you're spreading misinformation for stating the obvious facts? My name is Del Bigtree. I am the CEO of MAHA Alliance, MAHA Worldwide, MAHA Action. But really, I'm just one representative of many, many incredible voices in a grassroots movement, a true grassroots movement for medical freedom that started many years ago and now has found real focus in this movement that we're now calling. I want to take just one moment to thank President Donald Trump, someone who is the first candidate that we ever saw dare to make the statement that vaccines cause autism, or that he thought that they did, that he wanted to do investigations into vaccines. And I'm not talking about this last election, I'm talking about the very first one. And every time he was asked in different scenarios, or whether it was on a debate stage, he said, I have seen children run across my office that were healthy, went and got a vaccination, and suddenly we're having issues spelling and reading. We've heard the story over and over again. I'm one of those that has probably heard that story more than most, because I decided to do an investigation. I'm just like you, all of you in the room. I'm just a journalist, I'm just a reporter. No, I have no medical degree, but I did work for over 6 years on a medical talk show called The Doctors, where every single week I read medical journals to find stories of breaking news and science. And I learned to understand how to read that science, as Robert Kennedy Jr. has said the very same thing about being a lawyer. When I think, where is this movement coming from? What is it? Seeing all the reporting, how far back do we go? Robert Kennedy Jr. began talking about this when he was first asked by parents that were coming up at his environmental hearings, where he was talking about mercury in the water, saying it's toxic, it's destroying health. And those mothers said, will you please look at the vaccines? There is mercury. The same thing you're fighting to get out of our water is being injected into our children. Of course, he was reticent because mainstream media and mainstream medicine scares everyone away from ever doing any investigation into that. But eventually a mother sat outside of his door with a stack of studies, and he couldn't ignore her. It's much like what happened to me. I was working on the doctor's television show, and I was tipped off that there was a whistleblower inside the CDC named Dr. William Thompson, who was going to come forward and say that they were committing scientific fraud in vaccine safety studies, specifically the MMR autism study. I made a documentary ultimately about that because, as many of you are aware, I pitched it to my executive producers. I know who you work for. I work for CBS. And they said, we're never going to go near that story. There is no way we're going to do a story that calls out the CDC and says that they're committing fraud of any kind, because we got to go and report on the latest flu epidemic, and they would let us behind the scenes, and we would make it into television, and we're not going to hurt that relationship. We're also not going to go after a product made by Merck, It was just one of the pharmaceutical companies that fund the show and fund most of television. As you well know, if you work in television, somewhere between 50 to 70% of advertising is coming from the pharmaceutical industry, which is why you're mandated to write the things that you write and told the things that you cannot write. So sometimes it takes courage to step out and do investigation beyond that. Let me show you very quickly where that investigation should start for all of you. These are vaccine inserts. I had my COO, Bridget Rasmussen, go by a doctor and say, we'd just like to see some vaccine inserts. Twinrix, I mean, I could read them off, Haverix, Shingrix. Well, the experts say, when Del Bigtree or Robert Kennedy Jr. says that there's been no placebo-based trials to establish safety prior to licensure, I would probably put money that none of you reporters have ever grabbed one of these and read it. Or if you did, then how did you write? The experts say that that is misinformation, because it's written in every single insert that shows up with every single vaccine that you've taken and that our children have been given. There's a very interesting conversation that happened during the hearings between Rand Paul and Senator Cassidy. Senator Cassidy brought up the importance of the hepatitis B vaccine, telling an anecdotal story about a young girl that he cared a lot about who was having liver failure. A tragic story, absolutely. But for Robert Kennedy Jr. and I and so many people in this room and thousands and thousands and thousands of parents, there is a story of a regression into autism, or of seizures, or of encephalitis, swelling of the brain in their babies after a vaccination, that apparently we're not supposed to care about that story. That Bobby Kennedy can't tell that story. That child doesn't matter. In the conversation, Rand Paul pointed out that hepatitis B is a sexually transmitted disease. The vaccine was developed for prostitutes and people that were having extreme sexual relations, or heroin addicts. And he said, I think that a parent should have a right to decide whether they vaccinate their one-day-old baby, which is when this vaccine is delivered all across America. You should be able to opt out of a hepatitis B vaccine, since it is unlikely in the near future for a day-one-old baby they will be having extreme sexual intercourse or sharing heroin needles. So what is the purpose? And of course, Senator Cassidy, and I'm very glad that he had as many deep conversations as he did with Robert Kennedy Jr., but right before our eyes we saw what conversation can happen when reasonable people start talking about an issue that they've never been allowed to talk about before. Senator Cassidy, in front of television all across the world, had to state, you know what? You're making a good point. It is a sexually transmitted disease, but in mothers that are hepatitis B positive, that vaccine is going to save that infant. Senator Rand Paul pointed out, rightfully so, that every mother in America is tested prior to delivering a baby. We know whether they are hepatitis B positive or not. So why is every woman being forced to give their baby a hepatitis B vaccine when we already know their status? And right there, in front of the world, Senator Cassidy said, you know what? Okay, I don't think a mother should be forced to take it if she's hepatitis B negative. We just watched the first transformation of a medical doctor in an important conversation, changing his mind based on the available science. That, was he unaware of it prior to that conversation? I don't know. Or had he forgotten about that? I don't know. But what we did see is a mind being changed. And so when people say, is Robert Kennedy Jr. going to take a vaccine away? I would say Robert Kennedy Jr. is going to begin a conversation of transparency, of talking about the actual science that is written in every one of these lists, pages and pages. You say you're doing your job. Who are you working for? We are supposed to be the fourth branch of government, the fourth estate. We are supposed to challenge these things and say, for how many years will we let these injuries happen before someone decides to make a better product or do a study and figure out Is there a test we can do to see if you're vulnerable to these injuries? We've never studied who these injuries are happening to. Sure, go ask the experts, just like Tony Fauci, who told you social distancing was science and questioning him was questioning science itself. Just like the vaccine stops transmission, which every single one of you wrote. I don't know how many of you have apologized for getting wrong. But on the high wire one day before anyone, the show that I do online, before anyone received a COVID vaccine, I read the emergency use authorization by the FDA. And it said very clearly, this study could not prove whether or not this vaccine can stop transmission. So what were you writing about? Where was your science, and exactly how do you call the people that got it right the spreaders of misinformation? You have been the spreaders of misinformation. You have gotten it wrong. And America is still waiting for an apology.
Yes.
Let me get back to hepatitis B. Not only is hepatitis B a sexually transmitted disease, or shared by heroin users, so there's no reason a day one old baby should have to get it. Let me show you, I got it blown up for myself so I could actually read it. You can go to FDA approved vaccines, just Google it, and every single vaccine in our program pops up. This is how easy your investigation can begin. If you decide to be brave enough to do the investigation. And then click on whatever vaccine on the childhood schedule you're curious about, and then open up the vaccine insert. 6.1, every single time, this is how this works, at 6.1, the clinical trial experience is written down. This is what they are telling you they did to prove the safety of a vaccine. There's only one way to prove safety, by the way. You have to have a safety baseline. In high school, you should have learned about the double-blind placebo trial. You have to have one group getting the product and one group getting a placebo that doesn't affect the human body in any way. And then we have them both, we track them, usually for years when it comes to cancer drugs, and it doesn't matter if you're dying of cancer, we're not going to let you trial that drug until we've proven it's safe. Years we follow them. How long did we follow the hepatitis B vaccine trial group? It says right here, 6.1 clinical trials. In 3 clinical studies, 434 doses of Recombivac's HB, you can look that one up, 5 micrograms were administered to 147 healthy infants and children up to 10 years of age, who were monitored for 5 days after each dose. Injection site reactions and systemic adverse reaction were reported 5 days. A 5-day safety trial with no placebo group. Look it up, it's there. Not misinformation, written by the drug manufacturer. I could do this with every single vaccine. Because of Donald Trump, we had a meeting at the NIH that I went to with Robert Kennedy Jr., one of his first presidents. And we said, why in all of these can we not find a single placebo trial with any of the childhood vaccines? Are you not doing placebo trials and establishing safety the way every other drug is established? Or are you just not publishing those trials? There was silence in the room, and finally Tony Fauci admitted, we don't do placebo trials on vaccines. Because it would be unethical. Unethical. For a vaccine like Gardasil, the first time they were going to try and deal with cancer, the vaccine, they had a belief that it was safe because they never did a proper placebo trial to test if it was. We just had an RSV vaccine just a couple of months ago, by the way, that finally had a saline placebo trial, and they stopped it because babies were getting sick, and it was clear that the vaccine was hurting children. Is that just because it was the first placebo-based trial we'd ever seen in a childhood vaccine? And let me say this unequivocally, if I ever see you write in your paper that the experts say a placebo trial was done, then you better print it in that article, and I've said that to all of you. and send it to me and Robert Kennedy Jr. because at the NIH, Tony Fauci and Francis Collins admitted we don't do them. So what does that mean? What does that mean for the safety of our babies and our children? A day 1 old baby is getting a product that we only cared to test for 5 days. Does a healthy child not deserve better than that? Because a cancer patient does. Our grandparents get products that are against placebo for years. Why are our babies not mattering? By the way, America has the highest rate of first-day baby deaths in the industrialized world, reported by CBS. Is that caused by hepatitis B? I don't know. Is it caused by bad hospitals? Are we a third world nation? Do we not know how to treat a day 1 old baby? Robert Kennedy Jr. is about to start having investigations in these horrible stats. And for anyone that says there's no such thing as vaccine injury, that's curious. Because written right here in 6.2, since you only did a 5-day safety trial, we are left with the post-marketing surveillance. I'd point out nervous system disorders for hepatitis B given to a day 1 old baby. Guillain-Barré syndrome, that's paralysis. And by the way, prior to a polio vaccine, that would have been called poliomyelitis. Paralysis still exists. It's still happening. Now it's a side effect of vaccination. Multiple sclerosis, exacerbation of multiple sclerosis, myelitis, including transverse myelitis, all paralytic diseases written here as being caused by a vaccination. Now you could say how many, but is that the only question? Do we actually live in a country where we're going to allow this to happen to anybody? Especially a day 1 old baby? Let me continue. Seizures, febrile seizures, peripheral neuropathy, Bell's palsy, radiculopathy, herpes zoster, migraine, muscle weakness, hyperthesia, and encephalitis, brain swelling. Open up every one of these vaccines in a childhood schedule, and you will find encephalitis, a brain swelling event. Is it that shocking, really? Since the vaccine is designed to cause an inflammatory event to get your immune system to kick into gear. That's why they put neurotoxins like aluminum in the vaccine, so it will incite your immune system to swell your body. And if you're unfortunate enough that that swelling happens in your brain, now you're at risk. The symptoms and side effects of a brain swelling event, which, yes, can be autism.